Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Ellipta inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. You should always sit upright or stand up when using your Ellipta inhaler. Use your thumb to slide the protective cover down until you hear a click. This will release a dose of medication. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Now place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Make sure that your fingers are not blocking the air vent. Take one long, steady, deep breath in. Remove the inhaler from your mouth while holding your breath for up to 10 seconds or for as long as is comfortable. Now breathe out slowly and gently away from the mouthpiece. Close the inhaler by sliding the protective cap back over the mouthpiece. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. If you accidentally open and close the Ellipta inhaler without inhaling, you will lose a dose of your medication. A counter on the inhaler will tell you how many doses you have left. When there are fewer than 10 doses left, half of the dose counter shows red. You need to reorder a new inhaler at this point. If you're unsure about how to use your Ellipta inhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.